Welcome to Bite Size Dental Marketing. Today I have Dr. Bryan Carmichael. Dr. Carmichael, I read that your dad's a dentist, you got an older brother dentist, a sister dentist, a brother-in-law.
Yeah.
Between that and then San Diego, undergrad in Georgia, dental school in Michigan, some work in Arizona to
Yeah.
Texas. Walk me through those.
So like you were saying, I was born and raised in San Diego. My dad was a dentist. He was pretty much the main one that got us all into dentistry. I originally wanted to be a veterinarian, and he was fine with that as well. But so I was the youngest of the three siblings. So my oldest brother and my sister was in the middle, and then me. So pretty much once I got to around college or so, that's when I really had to make the decision. And by then, they were all either in dental school or just becoming dentists as well. So I was just kind of like, it just makes more sense, I think, just to become a dentist, I think, at the end of the day. And then around that time period, I was able to go shadow at my dad's office as well.
Mhm.
So I got a chance to kind of see the day-to-day life as well. And I hadn't really had a chance to do that with veterinary medicine. So I was just kind of like, well, it just makes more sense. I think it may just be in my blood to go this
Mhm.
route, essentially. So I did, and so I went off to Atlanta for undergrad at Morehouse College out there. Went there for 4 years, and then got my bachelor's, and then went to dental school at the University of Michigan in Ann
Mhm.
Arbor, and I was there for 4 years too. And I kind of just wanted to try different regions of the country out. Really, I had been to the Southeast already, but not too much, and I'd never really
Mhm.
been to the Midwest yet. So I wanted to try out Michigan, and then plus when I was younger, it was just kind of weird. But I just always liked Michigan football when I was younger. I don't know why, because I
Sure,
born
sure.
and
They're a
raised.
powerhouse.
Yeah, yeah.
Mhm.
I just love that. So that was kind of like maybe like a sign as well that I got in there, because that was just kind of a shot in the dark. I didn't really have much of a connection there, but I got in there, so I was just like, okay, yeah, let's do it. And then after that, I did a residency in Arizona for a year, and then I worked there a bit as well. So pretty much around that time period, I was having to decide if I was going to stay in Arizona or go back to California or whatnot. And around that time, my brother was out here in Texas, in Dallas area, working. He did a residency at Baylor, which is now A&M. So he was kind of like, hey, dude, like Texas is a place to be at. I think you need to reconsider.
It's one of the
Kind of coming
fastest growing
here.
markets, out there. Yeah, it's a
Yeah,
good place to be a
yeah.
dentist.
And this was back in, so he was already out here in 2005. He came out here. So he did his residency for a few years, and he was practicing out here around that time period. He had already made the decision to stay out here. So it was just a matter of, do I want to come out there or come out here or do my
Mm,
own thing, essentially.
yeah.
So ultimately, I mean, we're real close. So I was just like, well, yeah, I mean, I'll go check it out. And I would come out here to visit often. And then, yeah, I just ultimately made the decision to come out here
Okay.
as well.
Now, when you think about how you run your practice and how your memory of your dad's practice as a child, what sticks out as the big changes?
I would say there are some similarities and changes. I mean, the changes for sure is just the technology change
Mhm, mhm,
for
mhm,
sure.
mhm.
But some of the similarities, I would say, are that I would say that his staff loved him and they were with him for years and years with him. He actually passed away in 2012
Mm,
as well.
mhm.
So, I mean, at that time, I think the youngest one had been with him for like 10 years. Even I think
Wow.
all the other ones were like 15 to 20 years. But so that's kind of something that I always wanted, or that I kind of took from it as well. Like I would always say, like I would want that for my practice as
Mhm.
well. That we were kind of like a family away from family. That was always something that was a dream of mine once I had my own practice. So that's been a similarity, I would say, because I feel like we're building that family now. Even though
Yeah.
I'm only a couple of years in, I still feel like we're building it.
Now, on the pre-show, we were talking about when you came to Texas, you were, working in lots of different offices. How'd you end up in, at Watauga?
It's kind of random, really, because at the time I was willing to travel all over DFW. So the consultant that I had been talking with, she basically would work with anyone from DFW area all the way. I mean, in Justin, Texas, all the way down to Corsicana area. So we
Mm-hmm.
kind of worked the whole gamut. And At the time, I lived about, I think I lived in Las Colinas around that time before I moved, but still, it's not a far drive at all for me. But I was willing to drive further. But she was just like, yeah, I just have this doctor. He's getting ready to retire soon, but probably not for about 3 to 5 more years or so. But he just doesn't really do any surgery, and I've been telling him that he needs to do more of that. He doesn't do that, which is what I love to do, really. And doesn't do any sedation, really doesn't really do nitrous or anything like that. So she was just like, I really think that you can grow here if you wanted to, but if you just wanted to add that as another office to travel to, then you can do that too. So I was just kind of like, well, I do have other offices that I'm working with, but I'll give it a try at first and kind of see what happens. And then ultimately, after about a year or so of coming here about 1 day a week, that's when he was just kind of, because COVID kind of came in 2020. Mm-hmm. Then right after that, he was just like, I wasn't planning on retirement for a few years, but I'm just kind of, I think this is a sign that I need to make my way out.
Yeah.
So, yeah.
Now, from traveling around to the different practices to today, when you think through the cases and patients you've looked at, is there one that sticks top of mind to you?
Yeah, there are different ones for different reasons. Good and bad.
Let's hear it.
I would say the good that I've made with people, I would say that just the smile on their faces afterwards, essentially from times to where they come in scared of the dentist. And a lot of times people have different reasons for why, but a lot of the times is from something that happened as a kid, usually some type of trauma with the dentist as a kid. But so they're really just anxious or whatnot, or they think that everything's going to go south. And then when things end up being great, just a smile on their face, sometimes the tears that come out of their eyes and stuff like that, that's always kind of stuck with me because, to me, it's just like trying to do good dentistry, trying to do well by people, essentially. But we kind of lose sight of the impact that it has on their lives a lot of times along the way. So that's always good to remember.
Yeah, you see more patients in a day than most people see dentists in a life, right?
Yeah.
We have 2, maybe 4 dentists in a lifetime, perhaps.
Yeah, but there are some cases to where I'm just kind of like, well, I shouldn't, knowing that I'm traveling around, I probably shouldn't have even started a case like this because it is something to where it's a bigger case, like with implants, essentially, I would say, to where it's something to where it's like, well, now I see why some traveling docs don't really do implants as much because a lot of times it's a case to where you kind of want to manage it yourself from start to finish all along the way. So that's kind of something that I would do differently if I was traveling again.
Yeah, it's tough to hand off a case to another dentist. Yeah.
Yeah.
Now, you've been out, 12 to 14 years?
12 and a half years. Yeah, a little over 12 and a half.
Now, what's been the biggest shift in you and your approach from, Bryan Carmichael 12 years ago to, Dr. Carmichael today?
Yeah. So one of the things, when I was in dental school, we kind of had like a group of friends and we were all similar minded people. We all wanted to own a practice and kind of do our own thing and become really successful. And so we still are like in group chats still to this day even. But around that time period, though, we were all kind of thinking that it was like this idea that we knew a lot, but we knew that we had to learn a lot as well. But it wasn't until I got into dentistry, into real life dentistry, that I was like, wow, there's a lot that I still need to learn. There's a lot. But it was like, okay, because I felt confident with everything I was doing, but it was just kind of like, wow, this is a different case, or this is a curveball that I don't remember learning about. So I guess just over the years, just kind of knowing that it's going to be a constant learning like life cycle, and what we thought to be the case 10 years ago may change 10 years later, and just kind of staying on top of that, being willing to critique yourself or be open to critique from other people, from other dentists, other mentors, other doctors that maybe have gone through stuff more or for a longer period of time. It may not be aware of the same technology, but they have seen a lot, and to utilize that information as well.
Yeah, no, it's so true. The rate of change is so rapid. And, I sometimes wonder, does it lead to better patient outcomes, or does it just lead to different, experiences? But it doesn't change that with, with cone beams and with laser guides and all the things that we have available today. We can certainly do dentistry less invasive and more graceful than we could, even a
Hmm.
decade ago. And that's
Yeah.
nice.
Yeah.
You know, now, when you think about your ideal patient, right?
Hmm.
Your dream patient, what what do you want them to experience in that new patient journey?
I mean, I would say the average new patient we have, there's some sort of dental anxiety there. So I'm always kind of aware of that, and everyone in the office is as well. So we want them to feel at home when they walk through the door. We want it to feel like it's a different experience than they've ever had in the dental office before. That would be the first thing. So when they walk through the door, I want them to feel like, this is kind of a different atmosphere than what I thought it would be right away. Like when I first talk to them, I don't even really talk about dentistry at all. I just try to get to talk to them, like we're just having a conversation. But then it's kind of like, oh yeah, so anyways, about your teeth, that type of thing. That's kind of the feeling to where I want them to feel as if like I'm wanting to know about them completely, which I do because that helps me to treatment plan what we're doing. Like I want to know where you've come from with your dental needs or your dental history or what you're trying to get to as well. And you can kind of get that information just by talking to them as well in general.
They say fear and money have always been the two reasons that people don't go to the dentist, and
Yeah.
still true now. I will say, as we've evolved our thinking, and I think that fear is actually more anxiety and
Hmm.
shame than
Hmm.
actual fear. Like I think that fear is probably anxiety on one end and shame on the other.
Yeah.
How
Hmm.
do you handle that? How do you handle someone who's come in, they haven't been to the dentist in a while, they feel, or perhaps they actually haven't taken proper care of their teeth, and
Hmm.
they're coming to you, right? Like, how do you take care of that patient?
Yeah, yeah. So, I mean, like you're totally right. That is a common thing that we hear from people, either the anxiety or the shame of it too, where they are just kind of like, oh, I'm afraid to open or let you see my teeth, or they will kind of say something to that effect of it. But I'm always just kind of letting them know. I mean, we see this all day, every day. It's nothing that we haven't seen before. And then sometimes I'll even tell them that I've had work in my mouth. I've had a root canal here or a crown here, that type of thing. So they're kind of like, oh, okay, wow. So you've gone through this too. And I feel like that kind of helps me to relate to them as well, to kind of say, like, I know what you've gone through, so I'm going to help you through this type of thing. I feel like that helps with them as well. I've had some people tell me that. I'm like, wow, really?
Mhm.
You've had work done? Oh, okay. You know what it feels like to be in this chair and get numb and
Yeah,
stuff
yeah.
like that. So yeah, I try
Mhm,
to help them by trying to relate to them to some degree,
mhm.
to not make them feel like they're an outlier or an outcast or anything.
Yeah, yeah. Now,
Mhm.
what's your favorite procedure to do?
I'd probably say wisdom teeth, yeah, yeah,
How
or
come?
any type of surgery really, but
Yeah, how
yeah,
come?
yeah, like it's kind of one of those things to where, and it's similar with root canals because I would say root canals are probably my second favorite, and it's a similar reason just because every tooth is different, really. Like even though we have the imaging, the X-rays to show what it is likely to look like. I mean, especially when it comes to taking out teeth, the X-ray may show that it should kind of roll out this way, but then once we get in there, it's kind of interesting how the body or the bone tends to kind of dictate how it wants to come out, essentially. And I
Mm,
remember some mentors kind of telling me that, and it didn't really make sense until you actually go through it. And it is true to where it's kind of different ways to manipulate the tooth. Sometimes the tooth wants to come out in a way that you never expected, and it's kind of something that is like, oh, okay, so it's kind of almost like a puzzle
mm,
sometimes as well to kind of figure it out, especially with wisdom teeth when they're impacted a lot of times because with third molars they just develop differently than the typical teeth. So a lot of times there are some unexpected roots
mm,
that
mm.
you may have to go after. So I don't know if it's like the adrenaline rush or what it is, but it's just something different every time. So I kind of like that challenge, I guess.
Yeah. Now, do you like doing front endo, back tooth endo,
Yeah,
all in the endo?
yeah, pretty much any endo. But over the years, I would say at first, like if you were to ask me 5 years ago, I would have said probably endo and surgery are kind of tied. But now I would say surgery is number one, then endo. And the reason is just because over the years there seems to be way more variation with endo with the root
Mm,
canal anatomy, where it's just kind of like, woo, the amount of it's very tedious, a lot more than you think. And it's like the better you get at endo, the more you see these variances as well, because the more you're doing as well.
Mm-hmm, mm-hmm.
Like, ooh, yeah, this is kind of something where it's fun and all, but at a busier practice, I don't know if I have the time to
Yeah,
work
time to
through a
working on
tough
someone that
tooth.
long. Yeah,
Yeah,
yeah.
yeah. So that factors in more. But I
Yeah.
still like it though. But yeah.
Now, what groups are you in? How, you mentioned a couple of mentors and some groups. How are you staying current?
Yeah, pretty much through Facebook groups that I'm a part of. I guess they're like private groups. You have to give them your dental
Hmm.
license and all that stuff, and they verify that you're a dentist before they let you in. But staying up to date with that is actually that's been more useful than a lot of things. I've been surprised about how informative it is to really talk to other dentists. A lot of them do a lot of the courses too. Like they're the main ones that are doing some of the CE courses that we do in person. But just hearing from other dentists that are trying different things. We've all been out for like 10 plus years as well, especially for the implant group that I'm with, the surgical group.
Hmm.
They're doing a lot of cutting edge stuff, and it's interesting to see those results and to kind of talk to people that know more than you about something, or to maybe help somebody else that may not know as much as well. So
Yeah,
that's been very useful. My brother and I are in that group, and some of my other friends are as well.
nice.
Yeah.
Well, guys, Dr. Carmichael, this has been so wonderful. I know you got to get back to patients, but I thank you so much for your time.
Oh
It's been a
yeah.
pleasure.
Yeah, no problem. Yeah, likewise. Likewise. Thanks for having me on.